County, WCCS 101.1 FM and AM 1160. Our conversation with Dr. Bruce Bush from the Indiana Regional Medical Center, brought to you by Marcus and Mack, a law firm representing injured people. Dr. Bush, good morning.
Good morning, Todd.
It's good to have you with us here today. We got a lot to talk about. It's not like every day we say to ourselves, gee, what's happening at IRMC? Because there's so much happening right now. But let's get into a couple of issues. Of course, IRMC announcing the policy a week or so ago about visitation at the hospital. And people might look at that as a step backwards, but they don't necessarily need to, just a precautionary step to make sure everybody remains safe, correct?
That's right. Our goals here are to keep our patients safe and keep our staff safe. If our staff are off because they're ill with COVID, they're not here to take care of people. And what happened is that we had a surge of positive testing that started about 5 days after Independence Day. In one day alone, we had 20 positive tests, and that had not happened at any time from the beginning of the pandemic here. So we were very concerned about this surge. It wasn't just a one-day phenomena. So we did roll back on our visitor policy to try and protect everybody inside.
So the explanation of the visitor policy is right now no visitation of patients at IRMC with very few exceptions. One of those has to do with mothers in labor, correct?
That's correct. And we're not without compassion here. Another thing that people probably don't think about very much is that we still have our usual population of patients with all sorts of other conditions and problems, and some of those folks here are near death. So we have made exceptions for family members to be with their loved ones in their last hours. Mm-hmm. And there are a few other exceptions as well.
Yeah. Visitation is just one issue at the Indiana Regional Medical Center. One of the others is the fact that IRMC continues to offer its full range of services, and we've talked about this with some others, including Dr. Clark last week. Putting off your health care, no matter what the condition is that you are concerned about, it's just not a good idea, is it?
That's right. We had noticed that, like other places in the country, emergency room visits here for heart attacks and strokes went down. And it wasn't because the COVID virus was curing those problems. Mm-hmm. It's just that people were afraid to come in because of the virus being in the community. So we have no way of knowing what harm or lack of benefit could have come to those patients. We're seeing that some, but not all of them, seem to be coming back now.
Yeah,
and they should come back.
Yeah, absolutely. So for folks visiting IRMC, say today, they're coming for lab work that's been ordered, for a doctor's visit, for any medical reason. Describe that experience. What's going to happen? They get out of their car and they approach the hospital.
Yes, so they approach the hospital and they'll see that it looks a little bit different because there's a small temporary building and also a long trailer sitting under the canopy. And they'll be greeted by a screener. The screener will ask some questions and also take an infrared temperature by putting the device near the forehead. And if the screen is passed, then, and almost all of them are, then the person will be instructed to wear their mask inside. If they don't have a mask, we'll give them one. And they're given a little card. It's like a ticket that tells everybody that they've seen that they've been screened.
Mm-hmm. And then they can go directly to the place where they need to be. In terms of when you get to the hospital, only the main entrance and the emergency room entrance are open, correct?
That's correct.
Yeah, okay. So those are the only two ways to get into the hospital building. That way you cannot bypass anybody that would screen you for whatever the case is. When we had Dr. Clark on with us last week, he revealed to us that, like every other hospital, when this started to become a major issue a few months ago, IRMC ordered a the machinery or the technology that would allow them to do coronavirus lab results right there on premises. And he said that by the end of last week or early this week, that would be in place. And the upshot of it would be that you would be able to get your results back quicker rather than sending them out to an independent lab that would then send the results back. And it would really cut down on that lag time. Has that happened?
Yes. In fact, we have two completely different ways of testing for coronavirus internally. And the first one that was developed a month or two back now was a cooperative effort with Dr. Barathon from the biology department at IUP. And that is a real-time PCR test, which is what you hear about most on the news. It's a very complex testing procedure. Mm-hmm. And there are only a few people in the community that have the skill to be able to run it, including Dr. Barathon and his two daughters. So it has limited capacity. Because of that limited capacity and the need for tests exceeded the number we could do internally, we had been sending them out to outside laboratories. And various labs in the last several weeks have reached their own capacities and have told us that they either would no longer accept our tests or ended up having a turnaround time for results that was too long to be of any use. And we're still waiting for, I think, about 66 test results from July 10th that were sent to the Quest laboratories. Mm-hmm. So some of those folks have had to come in and be retested because we are still doing preoperative COVID testing, and we're going to start notifying some of the rest of them today that we still haven't got their test results. I imagine they're out there wondering.
Sure.
And they haven't had a call from us because we haven't had a result. In any case, the new test that we started is an antigen test. That's different. And it can have a turnaround of probably about an hour, although we don't promise that to any of our internal people. We say, well, at the very most, it would be the next day before a test result is back. And with the addition of that test, we can do everything that we need to do for our patients here.
Wow. That is a major development because it allows you to move forward with medical care for someone, care that might have been delayed had you still been waiting for a test result to come back. That's
correct. And one of our problems that's been recurrent, and it's not our problem alone, is that there are issues with the supply chain of fluids, reagents, materials, swabs, tubes. Right at the moment, we're well supplied, and we're probably in better condition than we have been at any time during the pandemic.
This was something that came up in conversation with someone the other day. Has coronavirus and all that it has demanded of hospitals in terms of that supply chain, has it delayed or curtailed in any way the hospital's abilities to get materials needed, medications, anything else, for things other than coronavirus? Has there been any sort of a kink in the line there?
Well, there has been, but for the most part it has to do with personal protective equipment, such as N95 respirators, isolation gowns, gloves, that sort of thing. Really, since the pandemic began, we have not been able to receive from any source whatsoever around the world an N95 respirator. We're fortunate that we built up a supply in the event of a pandemic. Probably did this about 10 years ago. And so that supply has been waiting for the rainy day, and when it came this spring, we were prepared. So we have enough supplies now, but with a couple of items, it was really touch and go early on. Yeah. As far as other drugs go, we're in good shape.
Oh, that's good to know. Good to know, and good to see that there was that kind of foresight in order to build up that supply beforehand, which brings to mind the idea that this is an ongoing thing for you and for the rest of the staff at IRMC. Dr. Clark was telling us about the number of meetings that are held, daily meetings, sometimes twice daily, having to do with the latest developments and what IRMC's response should be. Folks there have really been on top of their game with the foot pressed the gas pedal pressed all the way down for quite some time, and I know that can be stressful, but you're getting it done.
There's more than 30 people that join me on what we call our COVID task force call, and we have this 6 days a week. So doing that daily with so many sharp minds really gathered together, we're able to react very quickly to challenges, and the challenges keep coming. It's either surge in the number of test results or problems being experienced at one of the skilled nursing facilities, or supply chain issues that have to affect our testing. But there's a lot of great people working on this, and I'd like the community to know that. Another thing they should know is we don't make anything up. We may occasionally do different things a little differently than other hospitals around us. That's because some things about starting and stopping visitors or preoperative testing are based on local conditions and not necessarily just what everybody else does. Mm-hmm. But for the most part, we're really following CDC guidelines and Department of Health guidelines in everything that we do.
That's good news to know that IRMC remains on top of things. Anything else as we talk with Dr. Bruce Bush this morning? Folks need to know about IRMC, COVID-19, and any of the other medical issues they have in their lives.
Well, the virus has been here now through the late winter and all spring. It never went away. It's not going away anytime soon. We here at the hospital keep reminding ourselves that we have to be on the top of our game at all times, and we really need the people out in the community to understand that this can be a deadly virus for people who are at high risk. It's really important to protect our parents, our grandparents, our loved ones who may not be able to fight this thing off, and it does kill people, and it still will kill more people. So wearing masks, maintaining social distancing, washing your hands, avoiding touching your face after you've been out and about, travel to other areas, all of those things are very important. And if you don't have to travel, don't. If you can wear a mask, do. And almost everybody can wear a mask. Mm-hmm. COVID is not a myth or a hoax. We all have to keep on our toes, and please do it for everybody's sake.
Absolutely. The one thing I did want to mention, because we focus so much on main campus, but IRMC at Chestnut Ridge, other IRMC facilities or affiliated facilities, I'm thinking of the HMI building, the various clinics, those facilities, those same regulations, those same restrictions are in place there too, correct?
That's correct, at least for the time being.
All right, very good. Dr. Bruce Bush, thanks so much for spending some time with us today.
Thank you, Todd. My pleasure.
Have a great day.
You too.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160, AM 1160.